respected dignitaries on the dais, and my dear friends. At the outset, let me position myself. I am somewhere in between the patient and the administrator, in the sense that we have a information technology team which runs the ICT in our hospital, a 1,200 bedded hospital, running a very, very successful ICT thing since early 90s, with all its problems. It continues even today, but by and large we are very successful. At the other end are the administrators, who are basically priests. We are a charitable organization who are not very comfortable with technology. Caught between the two is people like me who try to help out. So we try to understand the scenario and try to bring it across to the administrator. That is where I come into the picture. Therefore, I differ from all the members of the panel because I am going to be the crying baby, you see. So I am going to give you the feedback which can trigger probably better reforms. Therefore, the point number one I would like to say, put in inverted commas, primarily because all our IT vendors are there. See, the problem is something like this. ICT and the practitioners of ICT still consider themselves to be, I'm repeating the word, newlyweds, trying to discover the likes and dislikes of each other, not realizing that already 25 years of happy wedded life has gone. Okay. So we need to understand how to move forwards. Point number one. We talk ICT has brought in a paperless atmosphere. My administrator tells me earlier to that and now he says there is a 300% increase in purchase of paper stationery. Now what do I say? I mean, these are facts. I don't know about other institutions. The problem is therefore not with technology, my dear friend. The problem is with we, the manpower. Because if a State Bank of India official comes for treatment, he wants a paper document for his reimbursement. You get my point? We need to address these issues. I'm giving examples so that, let's work together. That's why I said I'm a person giving you feedback. I will give you one more example. Earlier, when the doctor used to come for rounds, in my institution I'm quoting, 10:30 he says patient is ready for discharge. By 3:30 the patient was going home. Today, even after 12 hours he cannot go home because doctor has discharged, the system does not discharge him because the insurance company has not responded. So let us understand these scenarios. There are instances where patient has to stay overnight because insurance has not cleared his bill. So these may be little issues, but it is not once in a way. It is happening very, very frequently. Next, we say information technology has brought a giant leap in diagnosis, giant leap in technology, etc. I can give you examples where my own relative, an endoscopy had to be done for query bleeding from the stomach. The doctors as well as the technocrats in charge totally forgot that the person is not comfortable in taking the endoscope into the stomach. That lady refused endoscopy. So we have to keep in mind that there is another element in this ICT implementation, namely the final beneficiary, namely the patient. Most important, dead, but today at this rate, even for that probably you will need equipment. So let's be careful. Let's not try to use technology to the other extreme. Next point, we have technology, we have automated billings. I can give you examples where the patient says, see, we are a 5-storied building, huge. The patient says, I I refuse to get admitted in this hospital in front of me, in front of my director. Why means, goes to the doctor, a particular investigation is asked, patient has to run around, go to a counter where something is done on the computer, an amount is charged, goes back to the doctor, studies it, doctor gives some other this thing. 4 or 5 times the patient is made to run around between the doctor and the point of billing. He says, I may not be sick because of the disease, but certainly dash, dash, dash. So we need to understand technology and try to apply it meaningfully so that our client, the patient, is comfortable. In other words, all through my talk, I am talking of only one thing. Let there be a human element in the use of technology. I can go on and on, but I will stop at this stage only to say that the primary focus of my talk is we are ignoring the patient. I think patient is everything, and without the patient, there is no technology, there is no practice. That's what I want to say. Thank you.